Hi, good morning. Hi, Chris.
Hi. Always
Hi.
good to know the links worked.
Yeah. This one's working. It's a bit strange because you put the other team's call on hold. So you hop out of one straight into another. So
Oh, I don't know. You'd think we'd all be used to Microsoft Teams by now, but still getting to grips.
yeah. So I think these breakout rooms are just for general chat about what issues anybody has or any concerns anyone has in a particular area. So I've been asked to chair this session around enabling technology trials. If anyone has any questions about how to do those within the trust around telemedicine apps, education, training, simulation, anything like that. So I see Neil's joined, Kai's joined, and Leslie's joined. So and a few others. People more coming in at the moment. Um, has anyone got any questions, any issues? Are people joining because they want to know how to carry out trials, or um, is it because they get involved in trials, or they've had bad views on trials? I mean, what would people like to discuss on this particular breakout? Definitely silence.
So, Martin, definitely be interested just for an overview of the process of going through a trial. I think that would be quite beneficial. From an engineering perspective, obviously, it's something that, I mean, I have engaged with the process before, but I think that might be quite beneficial to some of my colleagues just to hear what's involved.
Okay, well, are you aware of the SET Centre or the SET facility being set up?
No.
SET.
No.
Okay. No. Are you aware of the R&D department itself?
Yes.
Okay, right. Okay. So Karen is head of, or the associate director of R&D, and there's a SET, it's called SET, which is a whole new department being set up specifically to make trialing easier for devices. And part of my role as head of commercial innovation is to support innovators with trials going through the trust. And the process is relatively quite easy. The tricky bit is actually getting funding and share of voice in amongst the trial center itself. Now, there's 450 people that work in R&D, and over the next few months, the whole purpose of the SET Centre is to make it much easier to carry out trials within the trust itself. Historically, the trial centre was really just there to link up with the projects and processes that the University of Southampton were running as part of a formal programme. But going forward, it's going to be a much easier, more dynamic facility for anyone within UHS/UOS to actually use. So over the next couple of months, you will see all sorts of notices coming out about a facility that you can book up. But if anyone has a project where you would like to put a product through for a trial and you don't know who or what to do, just feel free to contact me and I can put you in touch with the appropriate people as and when this new facility comes online. So at this stage, there is a formal route through R&D that you need to apply for. But the good news is it's going to get a lot easier over the coming months. That's probably the easiest way to describe it, Neil. But I say the hardest part is trying to find funding for it. Now, what I'm actually doing, I'm actually setting up a innovation development center, which is externally funded. So I'm raising a few £1 million to make the whole funding process to support innovation or support projects so much easier, because even with the new I4I FAST project funding, it's still difficult to get funding to support prototypes and small projects. And trials can be expensive. They can cost anything from 20,000 right the way through to 300,000, depending upon whether it's a class 1 or a class 3. And then it's a matter of trying to book up slots, and that's the whole point of this SET Centre. So with this new external facility, if the project looks like it's got legs, then there's going to be this much faster funding route that I'm setting up. So that's really the crux of it. It's trying to find funding for a trial. And if you've got funds for the trial, then you're going to need to have, because part of it is having a clinical engineer to manage it, or a clinical project manager. And those posts are being set up and are being created over the next couple of months by Karen and her team. And that's really going to be the key to it all. It's who's going to be the person setting up the protocol for your particular trial. So a good starting point is, what are you trying to do? Where's the funding coming from? And what's the protocol going to look like? And then that can be put into the trial process itself. And at the moment, that's quite complicated, but it's going to get easier and simpler over the coming months. That's the key message I wanted to get across today.
Thanks. That's helpful. Regarding the costing, so I think that the message seems to be, if we have an idea for a project that would involve clinical trial, that there will be at least now a mechanism to actually cost it. So yeah,
I mean, there is a costing support function out there already, which can assist you in the same way as if you're applying for a grant. So if you have a project that you want to have costed, there is a support team already which you can which will help you fill out the appropriate forms, and they will help cost out the particular grades and everything else, which R&D will still need you to do. But that support function is already there if you need that help.
Thank you. That's helpful.
Okay, so I will dig out. If you bear me 2 seconds, I will dig out that costing link for you now.
Kai, you wanted to ask a question? Kai?
Yeah, Marty, so with the center, if we are working on proposal for the clinical trial, if we want to, for example, people work together from your team on the proposal, contribute for a specific aspect, for example, statistician or the healthcare or the health cost side. Is that someone you can link us to? Because I used to contact one trial center. It seems they are not interested in the early stage.
Right. Okay. So that's the trouble. The trial center is really historically been more interested in later stage projects.
Yeah.
I'm interested in very early stage. So when I speak to people, so I get involved. So I'll go back in stage. The sort of stage I get involved in is, I was talking to a clinician, a guy called Professor Bhaskar Somali. He's a clinical lead in Division A, and he was looking for a sensor to go up inside kidneys. That was his idea, as simple and as limited as that. So I said, okay, right. What do you want the sensor to do? He said, I'd like it to measure pressure and temperature. And that's all he had. So I got involved. I worked out what he needed, got the design sorted. I'm now in the process of building a prototype, funding that prototype, and then we'll then get that prototype tested in terms of its basic physics. And then once we've got that prototype tested from a physical point of view, we will then get units built and then put that through a medical trial. So I get involved in everything from just a mad idea in someone's head, if that makes sense, right the way through to someone's got something that's already been through and tested. So you can go from there. So in terms of costing, there's a lady called Connie Temple Brown, who's in the research grants. She's a research grants facilitator in the R&D department. There's a costing template that I can send across to you. And she's more than happy to send it out to you. So the email address, this is to help you for doing the grants. So if you email researchgrants@uhs.nhs.uk, that is it's a grant costing template, but that same grant costing template is also really useful for costing out trials and everything else as well.
Do you also have a staff, for example, if there's a gap in the current team, do you also have a staff who contribute to part of the proposal writing?
Do I have, so if you need something where you need help writing a grant or something like that, then I would point you in the direction of the AHSNs. So the AHSNs, do you know the AHSNs?
Yeah, we worked with them before.
Okay, so the AHSNs are actually funded by the trust, and they're more than happy to support grant writing for us or for you. So they are a really good resource that you can use to assist you in all those processes. So don't be afraid to go out to them if you need support.
Yeah, thank you.
Okay, the commercial team that I work for, we are basically facilitators. We are a very, very small team, but we just got lots of really good links to try and help people like yourselves. Now, the Innovation Development Center I'm looking to set up is looking to have more and more resources in-house. So if I can't find a resource, I'm going to fund it myself. So we're looking to have work alongside the AHSN. But if there is clinical resources or project managers, and if we don't have them, then this IDC concept that I'm setting up, we will recruit them and to support such projects. Okay.
Martin, what is the capacity of your team? That's one of the questions I think people will be interested, because I know with the university and the clinical trials unit and the clinical research facility, there's always a kind of a capacity issue. How do you pick your projects?
How do I pick my projects? Okay, right, good question. I say at the moment I'm managing, since I joined, when I joined 6 months ago, I had 63 projects. I've now increased that to 97. So I've added 30 in 6 months. And I'm looking to add another 30 over the next 6 months. But the way I screen projects really is around a business plan. And people say, how can you apply a business plan to a medical device? Well, it's quite straightforward, really. Whether we like it or not, everything is driven by the economics of a device. And the economics are on the health economics as well as the commercial economics. So if an innovator or if somebody has a concept, if they can't build a business plan which looks at what are the health economics around the device in terms of the savings to the trust or the benefits to a patient, and then the market competitive analysis and everything else, well, then it just doesn't go forward, because that's the harsh reality of what you need to do to apply for a grant or funding for it. So the way I funnel down, and out of my 97 projects, I've got 12 which I'm focusing on because they've got really strong business cases behind them in terms of the above the line and below the line benefits to the trust. So the first thing I'd say, if you've got a great idea, fantastic. What are the health economics behind it? And how does that all stack up? I just saw a question about funding for IP and everything.
The question is, if we've got, say we've got an idea, but we're not sure somebody else has already thought about it,
Yeah.
Or is even registered it, and it's not something that's easily Googleable, so to say.
Yeah.
Who can we approach who can do some proper systemic searching for us?
Right. So the trust has an IP policy, which means that if it looks like it's a really good project, the trust can take on and can do all those IP searches for you. We have our own patent attorneys. There is an organization called HEE that we use. So I'm carrying out patent searches all the time for a multitude of projects. So with things like Pneumasave and with the kidney sensor and a couple of other urine projects, I carried out a UK and a global patent search on those projects, which was around about 120 hours worth of search. So it's a professional patent search capability that was done on those, all funded by the trust.
So what would be the approach? Is it first to develop the idea, you think it's a good idea, and then we approach it, or should we approach it at an early stage? At what point should we be doing the comprehensive search?
Well, if you've got an idea, you should approach us as soon as possible. Then we register the idea in your name. And so there's an innovation disclosure form that gets filled out, which the R&D department, the university, and the trust then recognizes. And then we take it, and then the whole process kicks in from there, which means you then get recognized with that innovation going forward. And the process along the lines of the policy all kick in from that point on. So it's quite straightforward. And the trust actually has a very good policy compared to other trusts where the innovator gets recognized. Whereas with lots of other trusts, the trust just claims everything, which is crazy because it just encourages innovators to not come forward. Whereas we have a different policy to most trusts.
And from a slightly personal perspective, what situation with somebody like me who is joint employed by the university and the trust?
Interesting question. Well, I tie up with University of Southampton on a regular basis, and there's a lot of joint projects where the innovation is shared between the university and the hospital and with the innovator itself. And that gets sorted out on the committees that we have. So the first thing is, who is the innovator? And it could be that the key thing is you as the innovator is the most important thing. And then the percentage of the bit that belongs to the institution will probably then get split between UHS and UOS, if that makes sense. Because UHS and UOS are intrinsically linked in so many ways that we quite often have to split our bit accordingly. So that's quite a common situation.
Yeah, I understand the university has an IP panel. You could also put any disclosure there. And Martin, sure. I think that brings a kind of a discussion that's obviously outside the meeting around sort of the UHS, UOS patent IP sort of joint sort of management. I think that would be really fantastic if we can do something about that, or at least set it up formally, because there is some confusion, with staff where to go for various different bits. Joining forces would be fantastic if we can do that. I've been reminded there's 3 minutes. That was 1 minute ago. We've got 2 more minutes.
Oh, right. But the key thing, really, the key message is that trying to do clinical trials is going to get easier going forward than it is at the moment, because I know at the moment it's difficult. Trying to get time is difficult, and the key thing is trying to get a clinical project manager to run your trial, and getting the protocol sorted out is key.
Yeah, Elisa?
Yep, sorry, this might seem like a silly question, but I'm quite new to Southampton, so I'm trying to find my way around. I'm a clinician, but I'm not working as a clinician. I'm working as a researcher and a lecturer at the University of Southampton. So I assume that your services are for people who are based in the trust. Is that right?
In the trust and outside of the trust, I bring in I also work with a lot of SMEs and outside organisations who actually want to present technology to the trust. So with our patient first hat on, if there is great technology that could benefit our patients, then I work to bring that technology into the trust. So, you know, you could be working for Marks and Spencers, for example, and have a great idea, and then I then work with my team to try and onboard that technology and bring it into the trust. So I have this inside hat as well as an outside hat as well.
Okay, great, thank you.
Yeah, I think there's anything that crosses over clinical. Martin would be really an important contact, or his team. But of course, university also would have its channels, and I think that's what we're trying to do, is try to merge the two, so it's not so confusing. And I think Martin is absolutely right. Things will get easier as things merge together.
Yeah.
Okay, so we have to go back to the main chat now, and then if you could do that, please. Thank you.